Hello, I'm Claire. I'm a hospital pharmacist. As clinicians, we know a patient's medication regimen can be complex. They may have several comorbidities and be taking multiple medicines. They may see a number of different prescribers. Obtaining a list of all medicines a patient takes at home can be challenging. We need to set a structured, formal process to obtain a complete and accurate medication history, or as we call it, best possible medication history. Medication histories can be taken in a variety of settings, such as the emergency department, a ward, or a pre-admission clinic. No matter what the setting, the key steps to taking a complete and accurate medication history are the same. 1. Review sources of available medicine information, such as medication containers, community pharmacy lists, or GP referral letters. 2. Interview the patient or their carer about their medicines. 3. Verify the history with one or more sources of information. This is key to achieving accuracy, as some sources may not be current or accurate. And 4. Record the information on the patient's medical record. Use a form like the National Medication Management Plan, the front page of the National Inpatient Medication Chart, or enter it in the electronic medical record. This is Dr. Willis. Say hello.
Hello.
I'm going to take the good doctor here through the steps, and then we'll see how he does with a real patient. Step 1. Be prepared. Review any background information you can find on the patient.
Right, so I've looked up a medical history on the computer.
That's good. Things you need to look out for are how old is she, and is she able to give a reliable history?
What do you mean?
Well, some people get a bit forgetful as they get on in years.
Right.
What language does she speak at home? Are there going to be any communication problems? Social background. Does she live alone or in aged care?
Like a retirement village?
Yes, or a nursing home. Do they have a carer, community nurse? You get the idea. You should also check the containers of medicine she's currently taking.
How do I do that?
You ask her.
Really?
Go on.
Did you bring along any medicines you've been taking? Can I have a look at the containers?
That's it. If you start by asking her about her condition, how she feels, any problems, that sort of thing, it'll naturally lead into asking what she's taking.
Gotcha.
After all, it may be a problem with the medication that has prompted her visit. So check the dose and instructions on the label and make sure she's been following them. This will be easier if you explain why her medication history is so important. For example, you could say, "Hello, Mrs. Jones. My name is Dr. Willis. I'm one of the junior medical officers here at the hospital. My job today is to make a list of the medicines you were taking at home before coming here. This will help us ensure you receive the right medicines at the right time while you're here."
You want me to say it like that?
Oh, you can put it in your own words, but that's the gist. Then we need to establish if the patient manages their own medicines at home. You might say,
Mrs. Jones, who looks after your medicines at home? Do you manage them yourself?
that's the idea. If someone else does it for her, like a carer, local GP, nursing home staff, or a community pharmacist, you'll need to talk to them. While doing this, you'll also need to check the patient's identity against the medical record.
Name, medical number, date of birth?
That's it. Introduce anyone else who may be present, like a student or supervisor,
It's only polite.
and ask if this is a good time for them to have this discussion. It's always good to get a clear consent from the patient with stuff like this.
What if she says no?
Well, that's okay. Just organise another time that suits her. Just don't leave it too long.
Okay. Anything else?
We're only just getting started.
Oh,
See if she's had any allergic reactions to anything.
I knew that.
This may be complicated if she's taking a few different things, but let's eliminate the obvious ones first.
Are there any medicines you're allergic to?
Or has she had a bad reaction to something in the past? And if she says yes,
Then I'd ask her what it was. What was the medicine you had a reaction to?
anything else?
When did it happen? What exactly happened? And has this happened again since?
Good. Now write it down. Put it in their medication management plan or in the electronic health record.
I should put this on their medication chart as well.
Absolutely. Okay, so now the preliminaries are over, let's get down to it. We need to find out what medication she's taking and how she's taking them, one at a time.
What medicines are you taking at the moment?
Let's say there's a few. What's next?
How do you take this particular medicine? What's the dose?
Avoid too much jargon. And also, she may not have brought everything with her, so don't just go by the containers she's got with her. What about non-prescription? Not everything comes from a doctor, after all.
Do you take any over-the-counter medications, like Panadol?
Or in a pill form, for that matter.
How about eye drops, creams, inhaler?
That's the way. It's also worth asking about herbal remedies. Sometimes people just don't think of them the same way. What's most important is to find out what medications they are taking before admission to hospital and if they're actually taking it as directed.
All of this could be on the record, though, if they've been admitted here before.
It's good to double check. And we need to make sure she's actually taking them as directed. For example, you could say, do you have any difficulty taking your medicines?
Or about how often in the week would you say you miss taking your medicines?
Yeah, like that. Keep it conversational. Try to quantify the extent of poor adherence and possible reasons. Or if there's something new or some change to how they're taking it, then add this to the record. Put in as much detail as you can.
Like if they stop taking aspirin before surgery?
Yes, absolutely. This shouldn't be like an interrogation. Encourage her to ask questions. It's important she understands what all these medications are for.
What if there's a discrepancy between what she tells me and what the record is showing?
That's why it's so important to verify. Check the containers, check the prescriptions. Also admin records from the nursing home if she's in one. Check the GP or community pharmacy records, the electronic health record and anything from previous admissions and discharges. After all, the patient or their carer may not remember everything. Everything needs to be up to date. If it's older than 3 months, it may not be reliable. You'll need the patient's permission, of course, to do all of this, and then write it down in their health record.
This is a lot to remember.
You'll get the hang of it. When doing a history, just remember the following. Is the information current and accurate? Is it complete? And is it what the patient is actually taking? Now, in a perfect world, this should be easy enough. But this isn't a perfect world. Medicine containers are usually reliable, but you never know. Also, dose administration aids like a blister pack can't contain inhalers, liquids, PRN or variable dose medicines such as warfarin. Again, aged care facilities keep pretty good records, but make sure they're up to date and include all PRN and complementary medicines. And check you have all of the patient's charts. The same is true for community pharmacy and GP lists, discharge summaries and outpatient medication lists. Nothing is infallible, so it's good to double check all of these sources.
Kind of like defensive driving for doctors.
You could say that. I wouldn't. We've been through the key steps in obtaining a best possible medication history. Now let's see how our doctor fares. Mrs. Jones presented to the emergency department with worsening heart failure. Because of her age and comorbidities, the decision was made to admit her. Step 1. Introduce yourself and anyone else present.
Good morning, Mrs. Jones. I'm Dr. Willis.
Hello.
I'd like to ask you a few questions about your medicines, if that's all right.
Of course.
Before I begin, can I confirm your name and date of birth?
Step 2. Make sure it's a good time to talk. And then check their identity against the record.
My name is Dorothy Jones and I was born on the 13th of September 1949.
Now, what seems to be the problem?
Well, my legs are swollen and I'm having difficulty breathing, although it seems to have settled a bit now.
Mm-hmm. And what did the other doctor tell you?
That my heart wasn't pumping properly and I'm getting build-up of fluid in my legs and my lungs.
That sounds about right. I'd like to ask you about the medicines you're taking at home. That way I can make sure you receive all your usual medications during your stay here with us.
Okay.
Clearly, Mrs. Jones speaks English, so language is not an issue. And Dr. Willis just explained why her medication history is so important. That's all it takes. Next, we need to check for any allergies and adverse drug reactions.
Are you allergic to anything, or have you had any problems with any medicine in the past?
I had a funny reaction about 2 months ago. My face got all puffy. My doctor thought it was my tritase, but so he gave me some tablets to take the swelling down, and he swapped it over with Carver or something.
Carvazide?
Yeah, that's it. I've been fine since then.
Now it's time to get our patient's medication history. Everything she's taking and how often. This could take a while.
Do you look after your medicines yourself, or does someone help you with them?
Oh no, I do it myself. I wouldn't trust anyone else to do it.
Did you bring any of them with you today?
Yes, I've got them all here.
Oh, can I have a look? How often are you taking the aspirin?
Every morning with breakfast.
How long have you been taking it?
A couple of years now, since my heart attack. Keeps my blood thin.
Here's the Carvazide you mentioned. How do you take this?
Oh, that's the big pink one, isn't it? Same as the aspirin, every morning with breakfast.
And you've been taking this since your reaction to the tritase?
Yes, about 2 months ago.
No trouble reading the labels?
Oh no, my eyesight's fine since I got my new glasses.
How about this one?
They're my water tablets. They're a nuisance. Have to keep running to the loo whenever I take them. I've been on them for 6 years now.
They do have that effect. How many do you take?
2 every morning.
The label here says 1 in the morning. Has your doctor recently increased the dose?
Yes, he did. 2 days ago when my leg started swelling. I'm supposed to take 2 tablets in the morning now.
Any problems now you're taking 2 each day?
No, except I have to keep running to the toilet every 5 minutes.
Do you still take them when you go out?
Usually skip them when I'm going out.
How many times a week do you think you might skip these ones?
Once or twice. 3 times at the most.
Unfortunately, when you miss your tablets, your heart doesn't pump as well, and your swelling and breathing will become worse. That's what's happened this time. So it is important that you take all your doses. What about this one?
Those I take twice a day, 1 with breakfast and another around about 7 at night.
Okay. What about this one?
1 every night at the same time as the Betaloc.
And how long have you been on them?
Oh, they started them when I was in hospital just before Christmas, about 6 months ago. They lower my cholesterol.
You know your medicines.
This is what my life has become.
Don't forget to ask about non-prescription and over-the-counter medications and things that don't come in a pill.
I see you also have a Ventolin puffer.
Yes, the doctor gave it to me 2 days ago because I was wheezy.
Have you used Ventolin before?
No, first time.
How often are you using it?
I have a couple of puffs 3 or 4 times a day, but it doesn't work very well.
It may be the fluid in your lungs that's making you wheezy. I'll have a chat about that to the senior doctor and see if you still need it. Do you take any medications from the supermarket or chemist?
I take Coloxil and Senna when I need to.
That's fine. And just a few more questions to make sure there's nothing I've missed. Do you take sleeping tablets?
Oh yes, Mytamaze. Oh, I forgot to bring them. I keep them next to my bed.
How many nights a week would you say you use them?
Oh, most nights really.
We talked about your Ventolin puffer before. Do you use any other puffers?
No,
Any tablets or sprays under the tongue?
no,
Any hormone replacement therapy?
no.
You told me about the Coloxil and Senna you take. Are there any other medicines that you buy?
No, that's it I think.
Not even pain medications like Panadol?
Oh, occasionally, if I get a headache, I'll take a couple of Panadol tablets.
Anything for stomach upsets or heartburn?
No,
Any vitamins or herbal medications?
no,
Any medications you put on your skin like creams, ointments, patches?
No.
Any drops like eye, ear or nose drops?
no. Oh, wait, I have Zolotan for glaucoma. I didn't bring it with me. It has to be kept in the fridge.
And how do you use it?
1 drop in my right eye before I go to bed.
And how long have you been using that?
About 5 years now.
No other drops?
No.
Any injections?
Oh dear. My doctor gives me a vitamin B12 injection every 2 months. Oh, and the next one's due on Wednesday. What should I do?
Don't worry, we can organise for you to have it here.
Oh, good. I wouldn't want to miss it.
Any drugs that you recently stopped or changed other than the furosemide?
No.
Any other medicine apart from your vitamin B injection that you take weekly or monthly?
No.
And apart from the frusemide reaction, are you having any other problems with your medicines?
No, not really.
Finally, have you been taking any medicines that belong to someone else?
Like I don't have enough of my own to deal with.
You are taking a lot of tablets. I'm not sure I'd be able to remember them all. Do you ever forget to take any?
Well, I sometimes forget my evening ones. I try to take them about 7ish, but you know, if I'm watching TV or on the phone, sometimes I forget.
That happens. How many times a week do you think you'd forget?
Oh, once or twice.
And do you use anything to help you remember, like a dosing box?
No. Though a friend of mine has her tablets packed for her by the chemist.
Yes, that is an option. Claire, our pharmacist, can have a chat with you about taking your medicines at home.
Thank you.
That's all the questions I have. Is there anything you'd like to ask me?
No, not at the moment.
Okay, if you think of something later on that we should know, talk to the doctor or pharmacist on the ward.
Thank you.
The best possible medication history is documented in a paper record, such as the National Medication Management Plan, or in the electronic health record. The medication list can now be used to write the inpatient medication orders. Any changes made to therapy due to the patient's presenting condition on admission must be clearly documented. If the orders have already been written, the list can be used to reconcile the medicines ordered on the medication chart on admission. The best possible medication history should travel with the patient if the patient is transferred from the emergency department to an inpatient ward, from the intensive care unit to a ward, from hospital to home, a residential aged care facility or another hospital. It is important to remember that the patient's medicines should be reconciled whenever the patient is transferred to a different level of care. Taking a best possible medication history on admission is essential. It ensures medicine information is accurately recorded and communicated throughout a patient's stay in hospital and on to discharge. Here are the key points to remember. Interview the patient wherever possible. Remember that most patients vary from their prescribed regimen. This may or may not be intentional. Remember to ask about over-the-counter and herbal or complementary medicines. Use a checklist, such as the one on the National Medication Management Plan, to guide the interview. Confirm the medication list with one or more sources of information. Check a medication reference if unsure about a medicine, and document the history in the appropriate form or in the electronic health record. Time spent during admission to get an accurate and complete medication history results in better outcomes for everyone. Hi, Dorothy.
Hi.
This is an updated medicines list for you to take to your GP and pharmacy, so they know there's been some changes made to your regimen.
Thank you.
Has someone spoken to you about those changes?
Yes, they did. Everyone's been so very helpful.
It's our pleasure.
Bye.
Bye. Taking a best possible medication history can occur in different settings and be undertaken by different staff members. Make sure you know what your responsibilities are for conducting medication histories in your organisation. For more information, tools and resources on medication reconciliation, go to the website of the Australian Commission on Safety and Quality in Healthcare.